Good afternoon. My name is Charu Kaushik. I'm the Scientific Director of the Institute of Infection and Immunity at the Canadian Institutes of Health Research. And I'm also an HIV researcher working at McMaster University and running an interdisciplinary team for past 25 years. It's my pleasure to welcome you all today to the session titled Communities in Action, Showcasing Canada's New HIV STBBI Community-Based Research Investments. Just want to note that there is simultaneous translation that's available on Worldly should you require it. I'm guessing there should be, next slide is going to say that. I was going to say there should be some scan code somewhere. Next slide. Oh, I have to do it, sorry. Okay, so if anybody needs translation, just scan the code. Is this the only place, or do we have it? Okay, on all the tables, there should be a scan code there if you need to translate at any point. So I'll start the session by acknowledging that we are gathered on Treaty 1 territory, the traditional lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and the homeland of the Métis Nation. Winnipeg has long been a place of meeting, sharing, relationship building among Indigenous people, and we are grateful to be here today so we can work together to advance community-driven approaches to HIV and STBBI research. And I know that many of you have come from different parts of the country, so I'm just going to acknowledge on all our behalves, but feel free to do so if you want during your presentation. That we are gathered. We are very grateful to the First Nations, Inuit, and Métis peoples who have taken care of this land for time immemorial. And we are so lucky to be here as guests and uninvited guests living in these territories. And it's our responsibility to make sure that we are leaving the lands and the waters as we found them and are enjoying them for next 7 generations to come. So as many of you know, Canada has made very good progress over the past decades in terms of prevention, treatment, and long-term management of HIV, AIDS, and STBBI. However, despite these advances, we continue to see rising rates, and we've heard that throughout this meeting. One of the reasons we are here in Manitoba is because of the high rates of new infections here in Manitoba. Several communities, including here in Manitoba across the country, these patterns remind us that scientific breakthroughs are not enough. And that's being announced next door. So great to have science breakthroughs, but structural inequities rooted in stigma, racism, sexism, colonialism, and persistent barriers to care continue to shape who is most affected and who has access to resources. Again, this morning we heard from Natisha how the number one demand from the Black communities is access to care. And it's amazing to see how such great work is being done to actually respond to those demands. So it's for this reason that community-based research is not only valuable, but essential. Community leadership, lived and living experience, cultural knowledge has to be at the heart of our research response if we are to meaningfully change the trajectory of HIV and STBBI outcomes. So it's in recognition of that CIHR has made historic investment that all of these teams are part of, $23 million to support 19 community-based research teams across the country. And these teams bring together researchers, community organizations, youth leaders, elders, knowledge keepers, and people with lived and living experience. Their work reflects the priorities emerging directly from communities and address the real-world challenges that academic and clinical settings alone cannot fully capture or address. So today we will have the opportunity to hear directly from some of these newly funded teams. We are delighted that 12 of you responded to our request if you want to present, so this is great. And the teams will be sharing planned research activities, the partnerships they're building, and the approaches they are taking to generate knowledge and solutions. So this session is an opportunity to recognize the strength and diversity of the Canada's HIV STBBI research community and their excellent partnership with communities. The teams that will be talking today represent a wide range of contexts: urban and rural, Indigenous and non-Indigenous, youth-led initiatives, Black communities, gender diverse, 2SLGBTQ plus population, people who use drugs, newcomers, and many other key populations. And these projects span across prevention, testing, care engagement, treatment access, cultural safety, and community wellness. Our hope is that by today's session and hearing what other teams are doing, you can start to build new relationships, work together, strengthen your collective momentum for this national response that we are hoping will come through this. And the next phase of this will require, collaboration and continued commitment to equity and partnership. So that's why I'm delighted that we have 12 teams present here today of the 19, at very short notice, so we really appreciate that. And with that, I am delighted to ask the first group of teams or representatives to come up to the stage. So I will invite Team Bondi, okay, so that's the first group of people. I'll invite the representatives to come up to the stage. They will each have 5 minutes to present, and then hopefully we'll have 5-10 minutes for the Q&A. So I'll ask Team Bondi, Team Hawa, Team Rourke, and what's the last one? Let's see. Yeah, I guess that's the 3 teams, right? 1, 2, 3. 3 teams to come up. So first of all, congratulations. Last time we met, you were all in great angst about your application. So this is amazing. Can I ask for you guys to shift so when you're presenting, then I can sit on the corner because I'll have to run back and forth to introduce you. Okay, so the first presentation, 5 minutes each. You will see the timer there, and we are trying to time manage, but we're not going to push you off the stage. So just try to manage your time and make sure that you're speaking for about 5 minutes. So presented by Mia Bondi and Molly Bannerman, the project title is Equity-Focused Expansion of Trauma-Informed HIV Prevention and Target and Treatment for Women in Ontario via Non-Specialist Providers, Co-Design and Hybrid Type 2 Pilot Cluster RCTs. So over to you, Mia. And the slides are all loaded, and you have this here.
Okay. Hi, how are you? Good afternoon, everyone. I'm Molly. I work for the Women and HIV/AIDS Initiative, and I'm here with Mia. We are grateful to be here on Treaty 1 territory, and we are coming from Treaty 13 and representing work from across Ontario, many diverse First Nation, Métis, and Inuit communities. These are our disclosures, if you read really quickly. And I'm going to talk about the LOI stage of our work, the planning stage, and then Mia is going to talk about what we've been funded to do moving forward. In the LOI stage, we had 3 main aims. One was to create a framework of collaboration with cis and trans women and with service providers, including nurse practitioners, to identify barriers and enablers for HIV prevention and care among cis and trans women, and to identify key priorities to focus our work and move it forward in an effective way. So in this stage, we spoke to 88 people in a really condensed amount of time through the spring and summer of last year. We used 23 focus groups. We spoke to cis and trans women who included folks who have been or are incarcerated, folks who have newly migrated, trans communities, sex working communities, folks living with HIV, folks who use drugs, and those communities reflected Black and Indigenous communities, Latino and Asian communities, as well as white women. We also did focus groups with nurse practitioners. In the absence of representation in many northern communities, we reached out and also did focus groups with RNs in northern communities. We did focus groups with AIDS service organizations throughout Ontario, as well as with policy makers and folks from the government. And through that process, what we uncovered is 4 main barriers. One of those, not surprising, was competing priorities, whereby women, cis and trans women who participated faced housing instability and houselessness, issues around safety, which created competing realities for healthcare and HIV prevention and care, as well as complexities in criminalization and fear around processes of immigration and fear of deportation. We also heard from nurses in particular of system-level barriers, not being HIV specialists, not having directives in some cases, particularly amongst RNs, not having medication available in the communities where they were working in an accessible way, as well as competing healthcare needs, particularly for nurses in northern regions who are dealing with a vast number of health realities with really limited care providers and access to community. We also heard about service barriers in terms of folks accessing care, the complexity of accessing care, people who have multiple care providers or no care providers, and sort of discrepancies in who would be the person to provide care linkages in an ongoing, consistent way. And finally, one of the most significant things we heard about is around surveillance, fear of criminalization, particularly around drug use, sex work, or immigration realities, fear of being reported to child welfare services for disclosing certain things, and many other levels of fear around surveillance. And in terms of facilitators, the important part, the thing we want to facilitate in community, really what was prioritized is the importance of community leadership, people with living experience, the role of nurse practitioners working closely with the community and RNs, partnering in a really meaningful and deep way with community folks, including AIDS service organizations, the work of the Women in HIV/AIDS Initiative workers across Ontario, and really deeply rooting an equity and inclusion approach where targeting folks who face the most barriers would be the most central part to the work.
Thank you, Molly. So just 2 slides on our 5-year proposal. So we spent quite a bit of time talking to and with our focus groups about capacity building and training, and this will be a huge portion of what we do. So our idea is to do more focus groups because many communities were left behind. This was a very brief LOI, and we need a little bit more time to consult those communities where we weren't able to access. So we're thinking about doing about 0 to 18 months more of consultation. We've had tremendous support and engagement from the Ministry of Health on this, and I know they also want to speak to where we'll be doing our first models. We'll then be choosing 5 pilot sites that we roll out over 5 years in a bit of a staggered way with prioritization again around what we hear from community as well as with the Ministry of Health. So we're looking at 2 different models of care that will also have some overlap. One is an integrated HIV care model, and one has more of an outreach pharmacy link. And just to speak to what Molly mentioned about the LOI, the focus of this work is really on HIV prevention, all modalities of HIV prevention, including PIP and PEP, as well as incorporating injectables. And then I think the really important part here is also that we're incorporating treatment, which has typically not been done by nurse practitioners in Ontario because of something called the Facilitated Access List. And that was one of the reasons why we thought that this might be something to pilot. And I'm way over, but thank you so much for the many people involved in this work. We had a community advisory board and a service provider advisory board. Of course, thank you so much to CIHR. And then with the guidance of Molly, we also have acknowledged participants who are actually involved in this work by the names in which they wanted to be acknowledged by. Thank you so much.
Thank you both so much. And I had missed the team, one team initially, so we have next team Dag Lagarno from AQP-SUD, presented by Tangwei Hidrik. So, and the project title is Community-Based Approach to Strengthen STBBI Prevention and Harm Reduction in Correctional Settings.
Bonjour tout le monde. Thank you, everyone. We've written this proposal in French, but I offer you to present it in English if you prefer. If you have any question, any comments in French at the end of the presentation, feel free to ask it. My name is Tanguy Edrich. I'm the Community-Based Research Coordinator at COHR, which is the HIV/AIDS Coalition. I don't have any conflict of interest. It won't be a surprise to anyone that the prevalence of HIV and HCV in prisons is much higher than general populations. It's also the case for bacterial STBBIs, of course. So we need preventions and strategies in prisons. The same thing applies to harm reduction. We need harm reduction measures in prisons. There are strategies that exist and that are proven to be effective, such as needle exchange program, but it's very hard to implement in prisons. So we were thinking in terms of our community and our community organization, how we can improve prevention and harm reduction in prisons. So this is a collaboration between two community-based organizations. The first one is AQP-SUD, which is a Quebec association for the promotion of health of people using drugs. It's an amazing organization with doing by and for individuals with lived experience of using substances and incarcerated people. They're doing preventions. They are doing a lot of tools for people in prison and outside prison. They do a lot of advocacy as well, and they distribute resources and create workshops in prisons. On the other hand, we have COHR, where I'm from. We regroup 37 organizations in Quebec. We do awareness, prevention, advocacy, and we also experienced in community-based research that we've been doing for 30 years. So for this proposal, we had two objectives. The first one, in terms of promoting prevention and harm reduction, is an update of tools that are given to the prisoners by AQP-SUD. So some of the data are outdated, so we want to update the data, but also we want to sit with the prisoner to see how we can improve the distribution of this kind of tools. On the other hand, it's more about advocacy. We want to map the barriers and facilitator of implementation of prevention and harm reduction policies in prison. So for the first objective about the tools, so we will organize 20 focus groups inside and outside correctional facilities with peer researchers I will train to update materials on STBBI's prevention and harm reduction. We will co-create these tools with also drawings, quotes, and lived experience contribution of people in prison. And in terms of implementation, we will assess acceptability, relevance, and appropriation of the message with surveys before and after the implementation of these tools in prisons. And of course, there will be knowledge mobilization. We'll do the same pattern for the second part about advocacy. We'll do structured surveys, which will be online anonymous surveys, and also semi-structured qualitative interviews to try to map, again, the barriers and facilitator to this kind of implementation in prison. So we have our impact are threefold. First, in terms of the science, we create new knowledge of the best approaches to prevention and harm reduction in prisons in a community perspective. For the community, we will build capacity and we create new tools for people in prison and outside prisons. In terms of advocacy, we will create new recommendations to support more equitable right-informed, effective public health practice in correctional settings. That's our amazing team. So as I said, it's mainly a community-based research outside universities that I'll do with AQP-SUD, but there's also a lot of amazing people that are with us. Thank you very much.
So once we have the 4 presentations, hopefully there's time for a bit of Q&A or just comments about this. That was great, Tangway. So I'll invite the next team, Team Hawa from Western University, led by Rula Hawa. The project title is Increasing Capacity and Improving HIV STBBI Care for Middle Eastern and North African Sexual and Gender Minority Youth and Youth Living with HIV, Innovative Community-Based Approaches.
Good afternoon, everyone. Thank you for having us and for the opportunity to share our work. I declare no conflict of interest. This is our project team. For the large grant, we are operating in 5 provinces: Nova Scotia, Quebec, Ontario, Alberta, and British Columbia. And this is the list of our community members and knowledge users, researchers, and institutions, and then the other members or co-applicants. And these are our partnerships in Nova Scotia, Quebec, Ontario, Alberta, and British Columbia. Just to give you a bit of a background, the MENA region is endemic for hepatitis B and C, with an influx of immigrant and refugee, gay, bisexual, and men who have sex with men, GBM, and trans and gender diverse MENA youth. And again, with the influx of these vulnerable populations to Canada, they are disproportionately affected by HIV and STBBIs. There's an alarming gap in health research and care for this particular population, and measures to identify MENA, GBM, and TGD youth are absent from Canadian national health surveillance data, and as such, we're very much interested in filling the gap. This is the study objectives for the large study, as we are referring to it. For the LOI stage, we actually did environmental scanning for 6 provinces. We had the PEI as one of the provinces. It was hard to continue with such a small province, so with the large project that we have, it's going to be within 5 provinces. So we did run 6 environmental scans. We also had focus groups with a focus on youth, particularly with GBM, trans and gender diverse, and youth living with HIV in the 6 provinces. We ran focus groups, and we also did interviews with service providers in the 6 provinces. For the large study, our objective is to advance our community-centered approaches, particularly with engaging with these groups of youth and with building community partnerships. Objective 2 is to strengthen and build capacity. And objective 3 is to improve health equity, and in particular, we're looking at addressing structural, social, behavioral, and biomedical determinants of health. Our planned activities, so again for objective 1, advancing community-centered approaches, our plan is to develop and test culturally responsive sexual health and well-being activities, and in particular, our goal is to promote increased uptake of safer sexual practices and stigma reduction. We are using arts-based approaches in 5 provinces. We're building on our work in Ontario. We had at CAHR an ancillary event with a focus on photo voice in particular, but arts-based approaches. So we're hoping to take that for the remaining provinces. And also, we're aiming to have a 2-day national summit with the whole idea of building capacity. For objective 2, strengthening and building capacity, we're creating a community of practice. We are using a community research lead model such that we have a bit of a decentralizing of all of the activities, and the community research leads do report to a centralized team. That happens to be in Ontario because our team is in Ontario. We're also hoping to improve well-being and STBBI stigma reduction, and we are using mindfulness training in 4 regions. And mindfulness training, again, builds on previous work that we've done in Ontario, and currently we're also running a 2-year mindfulness study that's funded by the Ontario HIV Treatment Network, and we're hoping to build on those skills in the remaining provinces. For Objective 3, we're planning to improve health equity, centralize online knowledge hub. As an investigator with CTN Plus, I'm hoping that we can tap into that knowledge hub with CTN, build an inaugural biomarker database. This is going to be extremely unique given the absence of any data on this population. So the composition of fecal microbiota and disruptions in systemic immunity are biologically linked to a higher risk of STBBIs. In particularly, the focus will be on GBM. No research has addressed the biological risk factors for STBBIs among MENA communities in Canada, and we're going to be collecting blood and fecal specimens. In particular, the focus of this work will be in Quebec, where we have one of our co-principal investigators, Dr. Ali Janabian and Dr. Cecilia Kosteniak, who would be developing this and operating with this small sub-study, not small, but sub-study in Quebec, and then the whole focus is to establish this biomarker. And potential challenges and mitigation strategies. In order to address having work in 5 provinces, we are providing EDIDA training for all the team members. We're ensuring that we have geographical representation of all the leaders. We're engaging the research team through meetings. Clearly, we're going to have meetings with all of the team members, particularly with all the co-investigators on a quarterly basis, and we're definitely leading with cultural humility. Potential study impact, address and further our understanding of STBBI disparities. For, again, the first time we will be assessing the immunobiological risk factors associated with STBBIs among MENA communities in Canada, and strengthen capacity for community-based research by improving health outcomes for key populations that are very much disproportionately affected and very much under-researched and understudied. Thank you so much for the CIHR for giving us this opportunity to fund this work.
Thanks very much, Rula. So, okay, so final team in this theme is the Team Rourke from Unity Health Ontario, Unity Health Toronto, and presented by Wale Ajibwe. And the project title is CBR Center for Health Equity for Black Canadians, Prevention, Testing, Treatment, and Care. So over to you, Wale.
Good evening, everyone. So you have the team composition there, including the various co-applicants, knowledge, users, and collaborators. I have no conflict of interest to declare. So the vision of our CBR team is to reduce the incidence of new infection in Black communities in Canada. And the way we intend to do this is to increase the uptake of effective prevention tools. We all know that there are effective prevention tools, but access, uptake, and use has been very challenging for Black people in Canada. So our strategy is to utilize Black-centric intersectional CBR approach to increase the uptake of testing and PrEP in Black communities. Now, the way we intend to do this is very simple. For the past 5 years, we've tested an evidence-based strategy called the I'm Ready program, and the evidence for this was recently published in the Canadian Journal of Public Health. The I'm Ready program have demonstrated effectiveness to reach Black people and to also increase the uptake of testing. But the next level that we intend to do is to incorporate PrEP, both tele-PrEP and facility-based access to PrEP into the I'm Ready program, so that we can have a comprehensive program that will increase both access to testing and also to PrEP. So our intention is to promote this program that we've already found to be effective in Black communities. And we have several partners to be able to do this. Now, so these are our partners spread across Canada, and it includes AIDS service organizations, service providers, clinical providers, community-based organizations, and people with lived and living experiences, and you can see the list there. We have the ACB Steering Committee, which is an implementation science team. that coordinates all the community organizations that are involved in this. And finally, our approach is unique in two ways. First, we focus on the unique cultural and structural experiences of Black people to be able to understand and also address the barriers to testing and PrEP. And we also value the assets that Black people, all the partners bring to the table to be able to design intervention and strategies to promote the uptake of testing. We want to thank CIHR for providing 5-year funding to be able to do this work. Thank you.
Thank you so much. So the first group did really well. We have time. We have 10 minutes, actually. We have 12 minutes to have a discussion. So any comments? This group was put together because the focus of what the teams are really planning to do is really community-led models and equity-driven care innovations. So you heard, some new approaches to women and as well as people in correctional facilities, youth, as well as the Middle Eastern and North African youth population, and finally Black populations. So we tried to put together teams that were working, in similar areas or at least with similar approaches. So any comments or discussions or anything that you want to tell each other or ask each other? Last time we met, we were preparing for this. There was a lot of anxiety about who was going to get funded and not get. Everybody got funded. So maybe we can have a, yeah, well, you're welcome. It took a lot inside to kind of pull all that together, but it's here. We recognize that, it's very difficult and challenging to get community applications to come together and then not have them funded. So I'm hoping that we brought everybody together so that there can be more collaborative spirit now to sort of say we may have some commonalities, there's things that we can do together. So that's why we are hoping that this will lead to a productive conversation. So any thoughts or comments from the audience, other members of the team, or from the panelists? Yes, let's get us started. Do we have a microphone circulating? Maybe if you want to come up to the front, that'd be great.
If you're recording, it has to go on the microphone. I can say that, it's okay.
Is this the one? Okay, we'll go with this one, eh? First of all, thank you very much because you've each created a program that meets people where they're at, because we're constantly hearing about communities that are not engaging with our programs and services. And the reason they're not engaging with our programs and services is because we design garbage for them and then take it to them and say, what do you think about this? And they go, it sucks. So thank you for taking the time to create something that meets people where they're at. As a person living with HIV and doing education, this has been a constant struggle and travel to recognize that we are not serving everyone equitably, and we need to create programs that meet their needs. So thank you. That's all it is, just to thank you very much. So that's it.
Thank you. It's good to hear the validation of the approaches, but clearly all the fundable teams, so we didn't fund anybody who was below the funding range. So these are all very highly ranked grants. Any other comments? Do you guys have any thoughts on the approaches of other teams? This is the first time you're hearing about what each other is there and, what are the other teams working on. It's okay if we can just, there will be time afterwards for you to linger and talk to each other. Go ahead, Mia.
Congratulations to the groups. Wonderful work. So our focus is really on Ontario because we struggled to incorporate multiple provinces in like a provincially funded space. And just since all of, as you said, Charo, all of the projects are so community-led, community-driven, have you had that engagement with the Ministry of Health or other stakeholders about how like this might get rolled out, what the future plans are. We're just trying to learn a little bit from you. And then just while I have the mic, because this is a community-led project, I just wanted to thank some people in the room who I forgot to thank in my rush. Shanice, Grace, Asia, and Tamara, who are all in the room, I think. So, but over to you for some thoughts.
Okay, maybe we can do a quick round, in terms of the question.
So just
Anybody
like
can
in
start.
terms of like the future directions, we're all doing this work to hopefully impact policy, right? Impact policy, impact health systems. Any thoughts on engaging with government? How have you done that so far? Yeah.
Yeah, I just want to say no, we have not engaged with government, but we're hoping our main stakeholders or interest holders are community service providers and academics, a lot of knowledge users as well, and participants who are community research leads. We hope that we're able to at least affect policy. If anything, one of the objectives that we have, particularly around the biomarkers, we're hoping that some of the testing that happens and even the inclusion of stats maybe would include more of our population. Our population is always othered, like we're always the other, and we're hoping that some of this work that, we would be able to use that not only for Middle Eastern and North African populations, but also for other racialized groups that are not necessarily included in particular surveillance. Thank you for your question.
Yeah, so we are engaging government, but it's at provincial level, and it's basically for funding for testing kits, because that's very important.
We are not connected to provincial level. We are a community-based organization, so we are funded by public provincial funding. So this is maybe our connections. As I said, we try to do as much as policy change as possible to improve the situation in prison, and we're working mainly or exclusively in provincial prison. So yeah, for sure, we try to sit on a table with them and try to show our data and what we found, but so far, no.
It's good to hear these comments because, CIHR has moved, especially in the strategic space, which is the space towards fund and foster. So when we are no longer sort of saying, here's the funding, do what you want with it for 5 years. I mean, yes, do what you want in terms of the research part, but we are doing regular check-ins, and the goal is to bring together the teams so that we can have a discussion. And then, as many of you know, we work very closely with Public Health Agency. Right, so, and then the public health agency is connected to provincial agencies. So I think it's a good heads up for us to be able to make those connections so that what you're finding, at the community level can actually be translated into programs, both federally and provincially. So that's good to hear.
I do actually have one additional comment around that. There is an event, but that's only Ontario-based, so we're hoping that that would be in other provinces. We have one of our service organizations, one of our partners, which is the AIDS Committee of Ottawa. They're actually in combination with the CIHR, I know they reached out to me, and they've invited members of parliament to actually talk about the funding and the impact. So we're hoping that maybe more of this would happen in other provinces so that we're able to impact policy. Because otherwise, if member of parliament or MPPs or the provincial or federal, if they're not aware of what's happening, then policy will not be changed. So I think this is a good initiative.
Yeah, that was actually an initiative from the SHASRAC, which is the CIHR Advisory Committee. So we actually reached out to ACO because we've seen them do really good events in Ottawa.
Okay, excellent.
Because last year the HIV funding, which all of you know this, was insecure. And it was not clear that there was going to be a funding cut or not. So the HIV Advisory Committee actually said we need to bring the parliamentarians to hear what do we do. So we have worked with ACO, and that's actually an event that's happening next week.
Correct.
So
we need more of that. That's what I'm trying to say. Yeah.
Yeah, it was hard to put that together, but fortunately we've succeeded, and hopefully that lays the path for how we could do this in future as well. So good to hear that that's going around in the community. Okay, I think we should move on. Any other questions or comments? Otherwise, we'll move to the second group. So thank you very much. Again, congratulations. So our second theme is Indigenous leadership, land-based approaches, and remote realities. And I would ask, is that the second one? Yeah, okay. So Melissa Morris and Ken Bristow, Carmen Logie and Candice Liss, Melissa April and Joanna Mendel to come up to the stage. Excellent. So hopefully there's chairs for everyone. Yep. Carmen, you're going to squeeze in there? Okay, sounds good. Okay, so the second block of presentations will focus on Indigenous-led, Northern, and other initiatives that center cultural knowledge, land-based practices, youth empowerment, and self-determined research priority. It also highlights, these teams will also highlight the challenges and strengths of rural, remote, Northern contexts and explore how community governance and culture are reshaping health and wellness strategy. So the first team that I would like to invite is the team from Nine Circles Community Center, presented by Melissa Morris and Ken Bristow. The project is titled, let's see, Nindina Me Magani Duok. Did I do that okay? Reasonably? Okay. HIV STBBI Community-Based Research Hub to address the STBBI epidemic in Manitoba for all our relations.
Thank you.
I'm first.
I'll click it for you.
Oh, okay. So it's founding the hub at Nine Circles, an Indigenous-led response to HIV and STBBIs in Manitoba. It's a partnership between Nine Circles and the Aboriginal Health and Wellness Center. So neither one of us have any conflicts to disclose. So as you heard earlier in the week, HIV infections in Manitoba are out of control. And it's disproportionate within the Aboriginal community and even more so within women. The main drivers, of course, are substance use, houselessness, and systematic racism. And another big factor is there is no coordinated provincial HIV-STBBI strategy. Result of that is fragmented services throughout the province and limited capacity for system-level response. Tremendous opportunities. This is going to bring tremendous opportunities for communities to into the co-creation of solutions.
All right, thanks, Ken. So I'm Melissa Morris. I'm on the board of directors for Nine Circles Community Health Center. I also stepped in as the project coordinator during the development phase of this proposal that got funded. So Dr. Albert McLeod is our project elder. You may know him. He won the Red Ribbon Award. So we talked. He said ceremony. We came together in ceremony. He helped bring together some amazing elders from the Winnipeg area, including Métis elders, Anishinaabe elders, and Two-Spirit elders. We further consulted with stakeholders, people with lived experience, and community partners. And what we really heard was that people needed capacity building, especially people with lived experience. And you may have also heard during this conference that healthcare is very fragmented across Manitoba. We have a lot of rural and remote regions that really lack accessibility and equity in healthcare. And that there's a lot of policies that severely impact this. And that this project really needed, acknowledging the rates are really high in the Indigenous communities. It needed Indigenous governance, culture, and ceremony. So our outcomes for that was a partnership, like Ken mentioned, with Aboriginal Health and Wellness, which is an amazing organization here in Winnipeg that have taken on some of the burden of the HIV-STBBI work here in Winnipeg, we developed a really strong research team. that has an elder council, people with lived experience as co-applicants in this grant, and that constructed our research program structure. And so we, like I said, we're establishing a strong community guiding circle, people lived experience, the elder circle, Indigenous people on our research team, such as communities, alliances, and networks. And we're really, this is my favorite line in this whole presentation, qualitatively driven mixed methods community-based research. So I love mixed methods. We'll be looking at doing some journey mapping, which is built off some previous work at 9 Circles on journey mapping projects. And we're looking at tracing both multiple barriers to sexual health in the city of Winnipeg and in rural contexts. We're going to do surveys, and so really the ongoing thing here is really to influence policies and programs similar to what I do in other aspects of work. So our anticipated outcomes are really to develop and have Aboriginal health and wellness take the lead on this project and guide us to create a better model of Indigenous-led STBBI care. And I wouldn't say really better, but I would just say to develop a more broader context in Manitoba of what culturally safe care looks like across the province. And we also want to increase capacity for community-based research and leadership among people with lived experience through a variety of trainings and ways to get involved in the research, help deliver the research, and maybe do some KTE work on that. That would be great. And like most things that I'm involved with, we really want to create programs for people. We want to influence policy, and we want to improve alignment of equitable healthcare across the context of Manitoba, so from urban settings to rural settings. And the long-term goal is to provide equitable and sustainable care in Manitoba. Ken?
And last but not least, this is the project team and the collaborators. Lots of doctorates, but there is a couple of lived experience people on that list.
Yes, there are. Yes.
So we, and I honestly believe that we had a definite impact in how the proposal was put together, because we pulled it away from all the technical stuff and made it more real. Thank you.
Thank you. Yes.
Thanks very much. It's good to hear how things are coming together, especially because, there was a particular focus. This was the first time we did distinction-based approach for Indigenous community team grants as well. So it's good to see that remote communities are coming into the fold of the research and the program. So thank you so much. So the next team is the Logie team, and presentation by Carmen Logie and Candice Liss. The project title is Empowering Voices, Building Solutions, Addressing Intersectional Stigma in Community-Driven HIV/STBBI Prevention with Northern and Indigenous Youth in Northwest Territories of Canada. So over to you, Carmen and Candice.
Hi, everyone. I'm Candice Liss. I am the co-founder and executive director of Foxy and Smash and the co-PI on this funded grant. We have no conflicts of interest to declare. So the goal of our project is to reduce the impact of intersecting stigma and discrimination towards Northern and Indigenous youth in the NWT, and to reduce HIV and STBBI vulnerabilities. We have 3 main aims. The first is to work with young people in the North to develop resources and tools and activities that they are interested in. The second is to improve HIV and STBBI prevention engagement, working closely with young people. Actually, 90% of the staff at Foxy and Smash are actually under the age of 21, and about another 5% are under the age of 30. And then our third aim is to mobilize knowledge that we learned from this project. And just to give a bit of background, the Northwest Territories, we have high rates of HIV, STBBIs, vulnerabilities among youth. STI prevalence is more than 7 times the national average. We have high rates of chlamydia and gonorrhea and syphilis as well. But limited research has explored the intersecting stigma experiences among youth in the North.
Thanks, Candace. And why this matters is we see persistent disparities among youth, including among LGBTQ plus and Indigenous youth when it comes to sexual health outcomes. And we have a wide evidence base that we've created over the last 12 years, I think, showing that Foxy and Smash improve HIV and STBBI outcomes, increase knowledge, increase safer sex efficacy, increase empowerment, and increase resilience and youth leadership. And so we have 3 study phases, applying a transformative mixed method sequential exploratory design. The first is developing and co-creating with youth intersecting stigma reduction tools through a crowdsourcing open call with multiple ways that youth can share arts-based activities, including posters, videos, drawings, stories, zines, followed by charrettes, which are participatory workshops that bring together youth and diverse community members to co-design solutions. And we will develop 3 prototypes, one for youth in the North, one for parents and caregivers, and one for teachers. And we will pilot test these with youth in peer leader and land-based retreats. In phase 2, which we're calling Action for Prevention and Stigma Reduction, Foxy and Smash currently conduct school-based workshops in 17 communities each year with hundreds of youth. And so we will integrate the activities that youth develop for youth in school-based workshops and stigma reduction school campaigns. We'll also integrate the youth-developed resources for teachers with teacher trainings. And in phase 3, we'll mobilize knowledge, including using the resources that youth develop for parents and caregivers and integrating those into workshops and a digital learning bundle, toolkits for NWT teachers, and knowledge sharing at educator conferences, and also start working with healthcare providers through a think tank. And we're ahead of time. Imagine that. Anything else you want to say? We have 53 seconds. Look at that. Great. Just want a big shout out to Foxy and Smash for how many years? How many youth?
We are in our 14th year, and we've reached over 10,000 youth.
Great to hear. Thank you so much for that. And I guess they're controlling from the back. Okay, I'll let you guys do that. So our next team is Team Maposa from University of Saskatchewan, and presented by Melissa April. The project title is Rivers of Hope Through Strength, Strengthening or Leveraging Community Expertise and Capacity to Support Young Women at Risk of HIV and STBBI in Saskatchewan. So over to you, Melissa.
Hi, everyone. I'm Melissa April. I'm from Treaty 6 territory, homeland of the Métis, and I'm grateful to be here on Treaty 1 territory. So I work at the University of Saskatchewan. I work for Powassan, and I'm co-lead of Winiska. I do come from lived and living experience, so I don't have an academic background, although I have 7 years hands-on community-based research experience. And I guess I use this clicky thing, hey? Okay. So I have no conflicts of interest. So why Rivers of Hope? So we came up with the name of Rivers of Hope Through Strength is because we wanted to connect different communities throughout Saskatchewan, and what better way than Rivers of Hope Through Strength. Rising rates of HIV and STBBIs among women ages 16 to 25, disproportionate impacts on Indigenous women, women who use drugs. The intersecting challenges are housing and financial instability, mental health concerns, substance use, and systemic racism. So we actually held a solution summit last summer, and we had a graphic designer come out, and she drew this beautiful picture for us and talked about all the solutions. We brought different community members together. We talked about the bridging us all together, and what we could do to work together. It was a really good gathering. So our aim is to co-develop and evaluate culturally safe, community-led approaches, focus on young women with complex life circumstances, address social determinants of health and intersecting identities, generate actionable community-driven evidence, and strengthen healthcare system capacity locally and provincially. So how the project works. So we're grounded in participatory action research, Indigenous relational principles, community-driven research to action framework, and we're co-designed and trauma-informed wraparound care models. And then our innovative approaches tested is mobile outreach, peer-led navigation, and integrated prenatal support. And what we will do, research methods, so qualitative and Indigenous methods, system mapping and stakeholder analysis, developmental evaluation, health system capacity building, needs assessment, surveys, interviews, SWOT analysis, co-developed training tools and culturally safe protocols, pilot training and clinic and community health services, policy review to identify system level barriers and enablers. So turning knowledge into action, integrated knowledge transition. We want to do community forums, sharing circles, and knowledge cafes, and youth-led storytelling and presentations. This will be guided by a steering committee with researchers, Indigenous elders, and community partners. And the expected impact is to improve health quality and outcomes, stronger, more responsive health systems, and sustainable community-informed HIV and STBBI care. And thank you. Oh, and sorry, shout out to CIHR for funding, are amazing.
We forgot that too. Shout out others for leaving the room.
I recall having discussions with Dr. Maposa when we were doing an IAB meeting in Saskatoon, and they were like, we can't get community partners to sign, and we're like, okay, we'll extend, and we'll try to figure out how to extend the deadlines and everything. So nice to see this come together. Very powerful stories of young women and how they're able to integrate back into the system. So congratulations. Okay, our final team in this section is Team Jones from the Pacific AIDS Network, presented by Joanna Mendel. The project title is Thrive, CBR Team Grants to Strengthen STBBI-related Health Equity for People Who Use Drugs, including those who have experienced incarceration in small to medium urban, rural, and remote communities in British Columbia.
Thank you. I won't repeat that title, it's very long. Hi, my name is Joanna Mendel, and I am the Director of Research and Evaluation at PAN, which is a provincial organization in what is commonly referred to as British Columbia. And we support community organizations across the province that provide services around HIV, hepatitis C, harm reduction, and other health and social services. So I'm here to talk today about our project, Thrive. I will disclose that we have received a community-based research grant from Gilead, unrelated to the work that I'm talking about today, and no other conflicts to disclose. Firstly, I just want to acknowledge that the work that I'm talking today and the people that make up our team live around the province of what we call British Columbia on many unceded and occupied lands. This is a picture of the mountain where I live in what is traditional unceded Wet'suwet'en territory in what is colonially called Smithers, BC, and that's my dog taking in the view. So our project team is made up of many people from smaller urban, rural, and remote communities across the province. It is made up of, there's 19 people with lived and living experience of substance use, incarceration, HIV, hepatitis C, other STBBIs, representatives from drug user organizations, community-based organizations, health authorities, researchers, research groups, and we do have a representative from the Ministry of Health as well. And that's just a little graphic of where the communities that are represented by teams or by people on this team. You know, it's it's a lot of the province, but you can see there's still a lot of gaps. And if you follow kind of Highway 16, you can see where people are engaged in this work. And we'll be doing some mapping services around STBBI services and things, but there are big empty parts of the province on this team, and I think we'll probably see similar things when we're doing our mapping work. So the people that make up this team, many of this team has been meeting for many years, like probably more than 4 years, coming up with the priorities that were put into this work, and so we are so grateful and excited to be funded to do this work. So thank you to CIHR. This team is really excited to be working together and having these priorities come to life over the next 5 years. So our project is a mix of capacity building and research activities. It is focused on STBBI priorities and health equity for people who use drugs and or who have experienced incarceration in smaller urban, rural, and remote communities in what we call BC. So I've broken up our project into 4 kind of main activities. First, we have this research team, and that is who we've spoken about today, and hi, Jen, who's on our research team. This is a team that will be meeting monthly virtually, and also will be coming together in person yearly. So networking and kind of mutual support amongst this team and having this space for us to come together was something really important that we heard during the development phase. And so, and as is being in person together. So that'll be like our core team. Then we'll also be holding a community of practice, which will be a chance to bring other folks in doing work in this area. And those will be quarterly kind of learning and networking opportunities and for chances for reciprocal capacity building. I'm running out of time. We have the information gathering we'll be doing. Like I said, we'll be mapping STBBI services around the province, and also we'll be doing an environmental scan showcasing models of STBBI programs, which STBBI programs, which leads into this next part of our project, which will be community-led implementation science projects. So we'll actually be providing grants to community groups for their own identified projects based on priorities in their community. And then us as a research team and research staff, including peer research mentors, which we're in the process of hiring at the moment, will support research to happen alongside those projects in their community. This was just to kind of go into that process a little bit more. I'll just say that it will be a low barrier application process that we will support teams in going through, and then the evaluation and who gets funding will be led by peers on our team. Then, like I said, it'll be implementation and research alongside, and then knowledge mobilization built into that. We also have small knowledge sharing and engagement grants that we've written into year 1 to help teams kind of come together and decide what they might want to do in their communities. And then we'll be funding the actual community-led implementation science projects in year 2, 3, and 4. And I don't need to go into the timeline really, but this is just showing what I've already said. And then year 5 will be really focused on knowledge mobilization, data analysis, and from the whole project, but there will be knowledge mobilization built into the 5 years of the project. That's it.
Thanks very much. Great to hear, such a nice distribution across the different provinces. So we have teams in BC, Saskatchewan, Manitoba, Northwest Territories. That was exactly the intent of the program. So hopefully there are some, lessons learned or exchange of practices that, between the different teams. So again, that was one of the purposes, to bring together. So now you know what the other teams are doing, and there can be some ongoing exchange of, if you want CIHR to organize some kind of virtual meeting or something, we're happy to do that as well. I'm saying that as the team's kind of glaring at me, so. But yeah, as part of our Fund and Foster, it's easy to bring folks together if there's, so reach out to us if you'd like to do that. Any comments or questions? We are doing okay with time, but I know people want to get dressed for the gala, so I do want to finish on time. Any comments or questions? Anything you want to say to each other? We're good?
We're good.
Yeah, we're good?
We're good. Congratulations. Yeah.
Okay, congratulations to everybody. Excited to see how this work is going to go. Okay, so the next and the final batch of the teams are around the theme of community power, data governance, and systems level transformation. These teams will examine how communities are reshaping public health systems through data sovereignty, anti-racist and decolonial policy approaches, and national networks. It highlights how community-owned data, large-scale capacity building, and collaborative advocacy can shift power and structure and advance equity in HIV and STBBI response across Canada. So we have 4 teams, I think. The names are up there. Lance McCready, Shayna Skakun Sparling, Benjamin Klassen, and Nathan Lachowski, Muna Aiden and Felicia Critchlow, Alexander McClelland, and Carol Shield and Adrian Gouda. I think there may be some standing involved here, but let's get started so we can get some teams going. So let's get started with the Community-Based Research Center team, which will be presented by Lance McCready, Shayna Skakun Sparling, Benjamin Klassen, and Nathan Lachowski on the project title Addressing HIV and STBBI Among Two-Spirited, Gay, Bisexual, Trans, and Queer Men in Canada through Community-Led Research and Capacity Building, Centering the Needs of Indigenous People, Black people, and people living with HIV. So over to you, and
yeah, we're going to need to come up with a catchier name for this. Wow, that's tough. Hi, folks. Thanks for still being here at 6:15 on a Saturday after a couple of long conference days. My name is Ben. I use he, him pronouns. I'm Associate Director of Research at the Community-Based Research Center and presenting this work on behalf of a much, much larger team. So this is a project that is in collaboration with almost 20 community-based organizations across the country that are listed here, as well as like a larger academic team. And really a project that is working to center specifically the needs of Indigenous and Two-Spirit people, black folks, and people living with HIV who are also part of 2SGBTQ communities. A project that is also really grounded in community-based research principles, of course, and a commitment to JIPA and MIPA, and a really like strong intersectional focus as well. What we're kind of trying to do with this work, like a lot of other teams, is to do some capacity bridging within our communities to really empower them to co-lead the rest of the grant activities, which we'll talk a little bit more about in the coming slides. This is my conflict of interest disclosure slide. And maybe I'll just pass it to Lance to talk about this part.
So we're going to mention 3 activities. The first is the investigators. We're going to adapt and deliver community-based research HIV STBBI curriculum for 2SGBTQM in Canada through 3 new investigator-type cohorts, specifically ones focused on people living with HIV, Indigenous, and African Caribbean Black GBMSM. Program participants will subsequently co-lead and co-design all the research activities with the grant team.
So, by a show of hands, how many people know what Sex Now is? The survey or the activity? Great. So I think just in the interest of time and the fact that we're together, one of the things that I would just want to say around Sex Now, which has been running for 20 years, basically with no sustained funding, we're excited to be able to have this opportunity in this grant to have some continuity in the program. And as part of this specific grant, we will deliver an in-person version of Sex Now. For anyone who is interested in any of your projects, if you're doing work that intersects with Two-Spirit and LGBTQ folks, we have a whole bunch of data that we've collected over the past decade, and especially in the last kind of 5 to 7 years at CBRC, and very happy to have folks talk with us about ways of sharing data, preparing data reports or things like that. So that's just an open invitation if folks are keen. The other part that I just think might be helpful while we're here in person is how difficult it has become to do low barrier online research for surveys. And so if people have also, maybe by a show of hands, experienced either bots, fraudulent responders, or malicious responders in any of their online survey work. Okay, a few less traumatized people, but we are out there. And if folks want to connect and talk about some of that, this is part of the reason why beyond the fact that it's a lot of fun to do this in person, although very sweaty during the summer season at Pride, part of the challenge around doing this work and wanting to provide honoraria and be accessible to folks who aren't just in urban spaces has been this online approach, and so the tension between those two things is real. And so if folks want to talk about that stuff, we're also happy to share our trauma and also some of our solutions and strategies that we've tried to use as well. So that's the Sex Now piece.
And then in addition to Sex Now, we'll be kind of complementing this work with some new qualitative HIV and STBBI kind of embedded studies that we're really kind of conceptualizing these investigators programs, developing the research questions around. And so that's kind of how the work will be conceptualized and led. So we have a couple of ideas about what that could look like in terms of things like long-acting HIV PrEP and long-acting treatment and things like doxy. But we know that this will be a really iterative and community-grounded kind of process in terms of articulating where that qualitative work really needs to happen. So next steps for our team, we're continuing to pursue some additional funding just to kind of build on this really amazing backbone that we have from CIHR for the next 5 years, partially to scale up Sex Now data collection. It's a really, really expensive thing to do nationally. And we also really invite other researchers, as Nate already kind of alluded to, community-based organizations, healthcare providers, and public health stakeholders who are interested in being part of this work to connect with us. Yes, 2SGBTQ communities intersect with a whole lot of other communities, and so if that's any part of your work, let's talk about that and how we can work together around addressing HIV and STBBIs. Yeah, I think that's it. Thanks, folks.
Welcome to sit. I'll play musical chairs. Okay. So thank you. Thanks to all three of you for explaining the part of the team or the teamwork that you guys are doing together. Our next team is Team Massaquoi from University of Toronto, presented by Muna Aiden and Felicia Critchlow. The project title is Not Business as Usual, Building a Racially and Culturally Appropriate Evidence-Informed Transformative Approach to Addressing HIV in Black Canadian Communities.
Thank you, Dr. Koshik. Thank you to the CIHR for making this opportunity possible. I just want to share that I am presenting on behalf of all of our co-applicants, and I'd like to share regrets from Notisha Massaquoi, who is attending to a family obligation and couldn't be here with us this afternoon. This is Dr. Massaquoi's disclosure. She has a few conflicts to declare, or just some items, and I have none. So I'll walk you all through the core objectives of our initiative and how they work together to advance health equity for Black communities affected by HIV. Our first goal is to organize and launch a truly transdisciplinary research team, one that brings together social scientists, clinicians, community leaders, policy experts, and people with lived and living experience. We hope that by intentionally integrating social structural perspectives, we can help to accelerate the development of strategies that can meaningfully reduce and ultimately eliminate HIV disparities. To sustain this work, we're also building an infrastructure to support trainees and new investigators. This includes structured mentorship, cross-provincial and national collaboration, and opportunities for emerging scholars to contribute to CBR HIV research early in their careers. Our work will aim to generate critical knowledge that can directly inform policy responses, and central to generating this research, primary and secondary research, is engaging Black community stakeholders. From this engagement, we will develop a community-informed Black policy and research strategy, and this strategy will articulate clear advocacy priorities and research needs for Black communities nationally. Some of this work has already been done in the LOI stage and will continue. We also aim to identify and model best practices for sustainable, equitable, and multi-sectoral partnerships. This means building the structures to support long-term collaboration between universities, community organizations, and Black communities. Finally, we will work on strengthening the Interim Committee on HIV among Black Canadian communities, who, as some of you may know, have authored the Black HIV Manifesto, and we're trying to support them in positioning it as a national consultative body for HIV-related policy research and knowledge mobilization. Together, all of these objectives form the pillars for a cohesive strategy, system-level strategy, to advance equity, better utilize capacity and lived experience expertise, all to ensure that Black communities lead and shape the future of HIV research and policy in Canada. And so you'll see that our 5-year project will roll out in the 4 phases listed here, starting with our strengthening community engagement and capacity building work. We'll also be exploring data collection and analyses, primary and secondary data collection here, and then integrative knowledge translation and knowledge mobilization for policy action. And so for our supplemental funding, we've developed what we call the SUSU plan. And across West Africa, SUSU refers to a traditional rotating savings system. This is a system whereby a group of people contribute funds at regular intervals, and each member takes a turn receiving the pooled amount. This practice is deeply rooted in trust, mutual aid, and community accountability. So we're reinterpreting this instead of as savings, we're interpreting it as funding. And so this plan will help provide financial and professional support to Black scholars to help us create a pipeline of Black HIV researchers. It will help us strengthen community-anchored scholarship and generate evidence that directly informs policy practice little by little. And so the activities for our supplemental plan will include designing and implementing our postdoctoral HIV fellowship program. We'll also design and implement the transformation grants. These are at $5,000 each for any level of study. And we'll also design and implement our Ignite grants, 2 per year at $25,000 to support early stage and pilot level HIV projects that show promise. We'll also be designing a national Black community HIV surveillance study, and our goal will be to produce consistent, comparable, Black-specific HIV data across Canada to inform policy, funding, and programming decisions, bringing us closer to our goal of data justice. So, yeah, that's it for us. Thank you so much.
Thanks so much, Muna. So that's good to hear all these details. And then we have a couple other teams. Team McClelland from Carleton University, led by Alexander McClelland. And the project title is a community-based HIV STBBI Public Health Observatory.
Thank you so much, Sharu, and thank you to CIHR for making our project possible. My name's Alex. I'm a person living with HIV, and I'm presenting on behalf of my amazing team, some of you who are in the room, happy to see you, for our project, a community-based HIV and STBBI Public Health Observatory. I have no disclosures. Our project originates from a very simple question that emerged in a community meeting that we held in Toronto looking at the intersections of criminalization and public health for people living with HIV, which was, where does my blood and health information go once it's collected in a clinic? This is a very simple question, one that we were not able to answer, and we've been spending the past couple of years trying to answer that question. This question has major implications if you're someone who's new to Canada, if you're someone who's under heightened forms of surveillance or criminalization, and something that's kind of the foundational component of our observatory plan. Our project is organized around communities of sex workers, migrants, and people who use drugs, and people living with HIV, addressing key concerns and ongoing kind of persistence concerns around public health and public health surveillance, specifically related to issues of consent, privacy, data uses and reuses, specifically in a context of electronic medical records and the increasing access and linkages between administrative data, and also looking at health equity issues. These are groups who are under heightened surveillance, but face intensified forms of marginalization in society, specifically around intersections with criminalization. This is our project team, and one of the key components of our project team was that we wanted to build real relationships with public health, not just kind of finger wag at public health about how we want them to change, but actually collaborate to promote solutions. And most of the groups outside of the legal organizations that we are working with are peer-led groups. They're by and for organizations. Sex workers organizations run by and for sex workers, migrant-led organizations run by and for migrants, and that was a key component driving our project. We also have a range of scholars, community-based scholars, emerging scholars, new scholars, and senior scholars who all work collaboratively to support a really broad and supportive mentorship environment for our team. We are developing an observatory. I should just highlight that observatory is not a parallel public health system. Observatories have been used in multiple different contexts to explore various different social problems, social phenomenon, and they can be closely observed and monitored. We're slightly flipping the script on an observatory by watching the watchers. So this is our community-based project will support communities who are often under heightened surveillance to actually look back and talk back to these systems and basically watch the watchers to explain what systems of public health surveillance are doing with data, how that's working. We'll be working, we have a training course called Who Counts, where people can go through this course to understand public health surveillance. We're going to be doing community-led monitoring and auditing of public health practices, specifically focused on issues of consent, data governance, and equity issues. And then we're going to have communities engage and understand how these systems are working, and then kind of talk back to our public health partners around ways we want to promote solutions. The key principles underlying our project is that our focus is on leadership of community, so the community organizations drive the project. We're laterally organized, not as a hierarchy, and kind of decentralized in how we're structured. We want to make sense to the communities they're engaged with, that are leading the project. So our key focus is making sense to the communities, not researchers talking to each other about research stuff, but actually making sense to communities. Having a consensus framework, focusing on data justice throughout the entire project and data ownership. We have an economic justice model. People are being paid to participate in all aspects of the project, and also just genuine partnerships with public health. Some of the real practical outputs of our project, just to make it real, are that we're going to be developing maps of pathways in blood and of personal health information so people can see where things are going and what's happening. We're developing tools for specific populations around knowing your rights in the clinic, or in the context of engaging with public health, so you can ask questions back and understand what you can and can't say, or what you can ask for, sorry. We'll be developing a library of normally kind of hidden from public view public health documents around how public health operates, and we're going to be conceptualizing new models for how public health data governance works, and also proposing new options for consent. For people to engage with in consent, ways around consent, around how their data is collected. Finally, we have this one practical tool that we just released, which is based on our Ontario project, or our Ontario project, which I encourage you to check out, which is mapping a map of what happens to your blood and personal health information in Ontario. Thank you.
Thank you very much, Alex. So the Final team is Team Strike from, am I right? Yeah. Team Strike from University of Toronto, presented by Carol Strike and Adrian Guta. The project title is Advancing HIV STBBI Health Equity Through Substance Use Health, a Pan-Canadian Research, Knowledge Translation, and Capacity Building Network.
Thanks for staying. You only get me tonight. You don't get Adrian as well. I'm pleased to talk to you about our project. I'm one member of a much larger team, and I have no conflict of interest to disclose. So what do we hope to achieve? We hope to create a pan-Canadian community-based network that generates, integrates, and mobilizes evidence to improve equitable, stigma-free HIV and STBBI and substance use health outcomes for people who use drugs. So we have a lot of goals. We hope to connect people with living and living experience, community organizations, researchers. We hope to strengthen capacity so communities can lead research and practice if they're not already doing so, generate and use evidence in real time, not many years out, translate knowledge into action, and to reduce fragmentation by building a more integrated substance use health system. So how do we plan to do that? Well, we're going to do some knowledge. We have 3 pillars: knowledge generation, capacity building, and knowledge mobilization. So like Alex, we're also going to create an observatory. We're going to do it to monitor and analyze substance use-related policies across jurisdictions across Canada. If you pay attention to harm reduction, what's happening across this country, lots of policies in place and practices across various jurisdictions to defund, make it go away. And we're going to pay attention to that over the next 5 years. We will create 3 multi-provincial team-based theme projects that will figure out what the topics are depending on what's very current with our Substance Use Health Network member surveys. They'll help us define what the topic is and then put the projects together. We also help to create a common understanding of substance use health. There are some definitions. We're going to focus on our Substance Use Health Network members and how they understand what substance use health means, and we're going to do that using a Delphi method. We also hope to create a data maximization lab. So a lot of us across the team, and probably some other teams, have lots of data that we've collected, particularly around safe supply and other topics. But we hope to, as long as it's allowed by our ethics boards, create a lab where we can pool all those data and make it available to various researchers and the like. And we will offer micro grants to support trainee and supervisor dyads to use the policy observatory and also the data maximization lab. So those are like little tiny grants to help pay for some time mostly. We hope to build and strengthen capacity to lead. We're going to pilot a buddy system with people with lived and living experience who already have experience running research projects, designing them, and we will pair them with communities or community organizations that are looking to build that capacity, and that will be funded with the buddy being funded to help to offer that kind of support to other organizations. And we're also going to provide targeted technical assistance to community-led organizations or groups to help them support it as they wish, research and evaluation, and we're going to do that from the team members that across our team. We also help to strengthen clinical and service provider confidence and skills using events hosted online by people with lived and living experience. We already do some of that through the Substance Health Health Network, but we're going to ramp that up. And we're also hoping to diversify substance use health leadership with structured mentorship pairings, thematic working groups with a particular focus on Black, Indigenous, and other racialized people with lived and living experience and trainees. And we're going to offer seed grants to make that happen. And I've been targeting some of you in the poster hall trying to make some connections that way. And we hope to mobilize the knowledge that exists from our team and from other teams, because some of the other teams are working in our space as well, We're going to restore and amplify the Substance Youth Health Network's weekly interdisciplinary drop-ins. If you haven't gone to one, they're open to anybody. You can sign up for the Substance Youth Health Network. We have about 1,900 members now, and we're looking to grow across the country. We're also growing outside Canada. We also, that has a resource lab, and we're going to elevate it and broaden it and add to it as we do some capacity building workshops over time. And next year, you'll see our first pre-CAHR symposium focused on for people in the local region and their work. We're looking for community-based research and evaluation projects and to bring those together before CAHR, and we'll provide some travel support so people can attend. And all our events and activities will be evaluated, and that will be led by people with lived and living experience. So we need to get moving because we have a lot of work to do. And you need to get moving because there's a party to go to or something else. So thank you.
Thanks very much. So as you can see, lots of systemic level changes, data governance, monitoring, et cetera. So, these teams have some themes, common themes here as well. Any questions for the theme, for the teams? Any clarifications? Anything you want to say to each other? So I'm hearing this, and I'm going to tell the team that, probably there's 19 teams, so it's a very large group. There's only 12 here. There's 7 more teams that are not here. So we'll have to figure out how to bring people together, because we don't want to have, anything that we do virtually for 19 teams to speak gets too long for people to stick around. So, so we'll have to figure out ways. If you have any ideas how you want to come together and at what time, typically we give people about a year or more, a little more, to kind of build the team and kind of, get going on things before we bring them together to sort of say what's going on, how could we help. We'll bring public health agency, we'll bring other partners together so that you can start to have that dialogue and they can start to hear what's happening at a community level. So I'm hoping that that will also happen. So if you have any ideas of when you'd like to get together or how you want to get together, it's a dialogue. So please reach out to us, and we'd like to do this together again. I say this as I finish up. I'm hoping that the next person will continue to do that, but the team is here to make sure that that actually happens. So my sincere thanks to everyone. I'm so grateful that all of you have come together. I'm very, very thankful that we could find and scrape together money to fund everyone. So, it's going to be exciting to see how the next 5 years roll out and how these teams come together and what kind of synergies come out of this. I definitely hope. I can see already lots of common themes and intersectionalities among different populations. So I hope everybody will take advantage of that.